Okay, all right. So Lisa just introduced herself. I will introduce myself. So it's Marc Boucher. I'm the education lead for primarily for Chris on the product management team, and we're looking forward to showing you some of the functionality again as we did yesterday with Chris and how it integrates with Acute Net through the use of a patient story, as Lisa alluded to. I just want to preface again, as we did yesterday, with the fact that I'm sure everyone knows and understands that we're working in it's a fake testing training environment. So obviously, we're not going to be looking at any real patient information or data. And some of the information that you'll see, it's pretty realistic, but you'll see some testing content in some of the tables and drop-down selections, sometimes a bit more than you might see in realistic production environments. So we just wanted to flag that for you in advance. And also the fact that, right for today, because we're focusing on AcuteNet, and Chris, Lisa and I are both doing a demonstration of that functionality. It's not to say that you need two people or any more than one person to do any of what we're showing you today. It could all be done by one person or several, or however you want to, arrange that to be done. But we just want to preface that because you'll be seeing two of us doing this work, but it could easily be done by one. So with that, I will turn it back to Lisa to provide some context and kick us off for the session.
Awesome. Thank you. So yesterday you were introduced to our patient, Athena Demo, and she is a 77-year-old woman. So yesterday we received an e-referral from a hospital in the Hamilton area. She had been admitted there with delirium, treated for infection, and was ready for discharge. So Athena was experiencing a decline in her functional status and was going to require support at home. So together, we all initiated the CRIS patient record from the e-referral. We initiated the integration to the assessment platform where we completed the interRAI contact assessment. We determined Athena eligible. We initiated personal support services and provided the ODB, or Ontario Drug Benefit Card. And we wrapped this all up yesterday in 1 hour, which we did great with our documentation and workload. So in today's scenario, it's been a little bit of time since Athena has come on to service, and we'll be doing a home visit to reassess and make adjustments to the care plan. So Marc will start us off.
All right, so I've just turned off my camera as well. You probably would rather look at the screen than my glare from my forehead anyway. So also, just from some of the questions that we did get, there was one that I think was a good point, that someone was asking if we could just see, how do you search for a client in the first place? Yesterday, we kind of kicked things off using the scenario of picking up a referral from the e-referral from hospital, an electronic notification, and we kind of took things from there, and we never really left the patient record or AcuteNet per se. So I thought we would just start off today with showing you the simplest, the most basic thing, which is to do a client search, and from there we'll continue with the patient story. So here we are. I've just logged into Chris, and I'm on the first landing page that most people tend to land on. It kind of depends on how you're configured or your setup and your role. And up until now, we've been talking a little bit about the different levels of Chris. So I'm just starting off on, as I mentioned yesterday, what's called the system level. So I'm not in any patient record yet. It's the top most level of Chris, and there's 5 of them. So that's called the system level. And at that level, there's 5 tabs you can see here for more high-level things like searching for patients, accessing tasks and notifications. There's different kinds of staff activities and reports, and different lists and queues and things that you can access that are just about clients and patients in general. But if you're ever going to look for, if you've got a patient in mind, and in a moment we're going to search for our patient, Athena, you might want to do a client search. Now, there's also a couple other ways of doing searches as well. I won't get into them now unless maybe at the end we've got a bit of time. But there's also a caseload search, so you might have your own caseload of your own set of clients that you're looking after, and in that case it would just be like a list of your patients, and you can kind of sort and filter and look at some high-level key information about just your subset of patients. Or you might be in the role of like an intake department monitoring this intake queue, and you'd be searching for patients that way on the intake search. But we'll start off with what's called the client search, and basically how that works is it's pretty simple. There's generally two fields. The one on the left has to do with different search parameters. So what information am I going to use to search with? So you can see things like first name, last name, the health card number. We often recommend using the health card number because it's one of the most unique identifiers to use. There's also a billing reference number that's specific to the referral that you might be looking for. There's phone number. There's what's called the client number. It's another unique identifier for the patient record. Postal codes there as well. So there's a number of ways of searching for a patient record. I'm going to be going by first name, even though I just said the health card number might be a better thing to do. Because I didn't want just one name to come up. I wanted to show you an example of multiple hits, if you will. So when you do a search, I'm doing by first name. So I can see here there's about 5 or 6 people whose name starts with Athena. This is all test data that we created, obviously. And how it's displayed is that you get the default is it defaults to all clients, but already if you chose to, you can narrow it down to just searching your own team's content and then doing a search that way. So it's just searching from a much smaller pool of people. And also you can see how it's displayed at the moment. Default is that it's displaying patients or clients with an active whose status is active. You can choose if you're looking for patients who are on hold, as an example. It could be vacation hold or hospital hold. I can see here that there's 2 people named Athena who are on some kind of hold, and it happens to be that they're both hospital hold. So we're going to look at one of those towards the end of today. But really, if you're trying to just cast as broad a net as possible, it's best to choose all teams and caseloads and all for the display so that you can see all the active patients, plus there's one additional one who's inactive here you can see as well. Okay, maybe that chart was discharged, for example. So that's something to look out for when you're doing a search. Make sure if you're just trying to cast as broad a search as possible, the all is a good tip to do. And then yesterday we touched on a little bit about this concept of the wild card, and you might call that the star or the asterisk. I like to think of the analogy of the wild card being like the blank square in Scrabble, or the middle square in a bingo card, for example. That counts for any letter. So let's say, for example, you might have received a document or a piece of paper that was handwritten, a client name that you're looking for, and you can't make it out. Maybe it's a doctor's writing. It's pretty notoriously the case. So you can make out the last few letters, but I can't really tell what that first letter is. So if you're not sure, you can replace that with the asterisk, and we're going to get the same subset of clients here because it's still going to work. But that asterisk basically represents the first, whatever letter that you're not sure about. That could come at the beginning, at the end, somewhere in the middle. And it's used or utilized differently depending on what you're searching for. So sometimes it's an address, it could be a name. Yesterday we used it to look for a pharmacy, right, that we sent the ODB authorization to. So it just comes in handy in a lot of different ways. So there's, sorry, just some useful tips for how we do a patient search. So we're going to return to our client later on very shortly. Athena Demo 2 is who we're going to use. But we wanted to start off today's, get back to our story by reviewing the dashboard. And so I'm going to click on, you know what, I'm going to actually access it through here. I'm going to access Athena's chart just to show you a quick and easy way to do that. So here we are back in the patient record. And since we're here, I'll just touch on the fact that I talked about the layout and the structure of CRIS. So we talked about the system level. This uppermost level here is what's called the overview, the client overview, the client level. It's the second level in CRIS. And then yesterday we looked at how we had a home care referral that constitutes the third level in CRIS, the referral level. Level 4 and 5, the last two, are the service level and the provider level, right? So you would, if you clicked on all of these are hyperlinks. So clicking on any of these would take you to that level where you can see and do things appropriate, at the provider level or the service level and so forth. So we use that to navigate as we move through CRIS. But we always like to allude to the fact that the client level overview is a good home base just to reorient yourself, as we said yesterday. Okay, so I'm going to access the dashboard, and I can do it by going to tasks and then clicking on the dashboard link, but I'm just a shortcut as well to let you know about there's a dashboard just for this particular patient. You can access it this way as well. I'm just showing you that just to start with, but I'm going to move right into the full dashboard right away. I'm just going to show you this because Lisa is going to talk a little bit more about the dashboard as driving the case management and alluding back to the story that she talked about earlier. So this is just the dashboard just for this patient, but I'm going to click on. You can set up a primary and secondary views, like different versions of how you'd like to see the dashboard. So under one of my views here, I have secondary view. It's all the patients under a particular caseload. So this is just a fake one. It's branch palliative, but just to give you a sense and a flavor of what we're looking at here. Okay, so this is the care coordination dashboard. And what this does is it provides a summary of patient information, and it kind of groups it into meaningful categories with actionable tasks. In the dashboard, the tasks are known as elements. And this helps to prioritize and manage daily care coordination activities. Another way of saying that is the task functionality can assist in coordinating and monitoring patient care. They can notify the user of an action to take, or maybe an upcoming event or a date, or just to share information with each other. And it displays these tasks in a format that enables us to review things in a more meaningful patient detail kind of format at a glance. And just a quick way to navigate the tasks efficiently. So rather than, as an example, by contrast, like an incoming, an email list where everything's just in a list chronologically, kind of groups things in themes and categories. And there's three basic broad categories or sections, if you will. There's the patient overview, assessment and care planning over here on the right. And the lower portion that doesn't have a heading necessarily, but it's just other kinds of tasks. So very, very simply or quickly, I don't want to go into great detail here, but in the patient overview, for example, you can see a slicing and dicing of your clients, your caseload by population. These are just different examples of the different populations that you may have. They may all be the same one if it's a realistic scenario, but just to show you that it could do that. And these are a list of different kinds of referrals that your caseload may have. Further on down below, we just see a list of patients who might be on hold, whether it's hospital hold or vacation or what have you. And it also has a snapshot of patients who may be at risk for different things. This one's in crisis for long-term care. We've got 3 people under that category, for example. Okay. And then there's some further information about patient hold management, different types of holds, and end dates that are coming up, or maybe even past due of when the hospital hold was scheduled to finish. A lot of things in CRIS are date driven, so you get a lot of tasks and reminders and notifications based on dates or change in status. Over on the right, Lisa will talk to you a bit more about this in detail and within the context of our story, but there's assessment and care planning where you'll see things like upcoming assessment dates that might be due, maybe some equipment or supply rentals that are due to pick up, provider reports perhaps that have come in or maybe coming due or past due. Down below, there's a number of other kinds of tasks. I won't go into great detail here, but one of the important ones to focus on here is what's called manual tasks. These two happen to be about a new document that was uploaded, and you can see that there are 7 documents that were categorized as being of medium urgency, 2 that were categorized as being low urgency. And there was a new referral that came in as well. So someone just chose, it's kind of like an email, if you will. So this is someone who just deliberately created a task, a message, and sent it to the caseload, the coordinator, for example. Okay. And so there's other kinds of tasks down below related to things like patient management, service management, equipment and supplies, placement, and so forth. But this is just to give you a high level flavor of how you can go about structuring and planning and organizing all the incoming stuff that you may need to do. And this is probably much more complex than you would likely be using in your case, but really it's very configurable, very flexible to choose to see what you want to see and how you want to see it laid out. So I think from there, I'm going to turn it over to Lisa, who will focus on the content of the dashboard as it pertains to our client of the day, Athena.
Great, thanks, Mark. Let me just share my screen. Okay, great. Can everyone see my screen?
Yes.
Excellent, thank you. Okay, so I am in Athena, and Mark, you did a great job of explaining the care coordinator dashboard, so I won't take too much extra time there, but I will just quickly jump in to the dashboard. And just to show for Athena, we do have a task here in relation to the assessment. So here under the assessment and care planning, we do have a task called Acute Net Initial Assessment Due. Just for context as well, I've been calling this the assessment platform, but it's also called Acute Net. So it's interchangeable at this time, the wording. So the elements within this assessment panel are generated by the assessment platform as well as the assessment document tracking in CRIS. So yesterday, you'll remember we put in when the intake assessment was due, the interRAI CA was due, which then opened that integration to the assessment platform. And what I did after our session yesterday was I went in and said, oh, we have an initial interRAI home care assessment that is due. And it is now showing up on the dashboard. So I just wanted to show you that you can open up the task. I can have a look at it. It is saying that I have an assessment due. And it is giving me that it's not overdue. So there are icons, urgent, high, medium, low, and they're colored. So it's not a overdue task, but it is something that I'm going to do actually today. So again, the dashboard is very, very helpful in managing your caseloads. I'm now going to head back to Athena. There we go. All right, so let's go into the assessment platform. So this will look familiar from yesterday. So I'm just logging in and I'm agreeing to the terms of use. And right off the bat, it brings us back into the patient record. And we can see right now that the interRAI contact assessment, or CA, that we did yesterday has been completed, which makes sense. We did that together. Now, yesterday I did review some of the functionality, including that offline ability, but I would like to highlight the dashboard just quickly that's in the assessment platform. So let's go there. So the dashboard is very useful in day-to-day work. You can search for patients, and like Chris, you can search by last name, first name, health card number, and also that unique number that's in Chris. And also has this kind of cool thing. Oh, can you see it okay? Maybe I can just make that a little bigger. Sorry about that. It does have my WIP assessment, so work in progress assessment. So for day-to-day, this is great. I can go in here and I can see all the assessments that I'm in progress of completing. So that's really helpful in that sort of day-to-day activity. You can add new patients in Acute Net. So if you weren't integrated with CRIS, you can add new patients here. But best practice is always to add your patient in CRIS and have that integrate over. And like other aspects of CRIS, the degree of functionality varies on the user's role and permission, even within the assessment platform. So you can see that there is an admin role within the platform. So I'm going to navigate back to Athena. Nice and easy there. All right, so we will be conducting an interRAI home care assessment as Athena is a chronic senior patient. So that was the caseload that we assigned her, or the population we assigned her yesterday, and she is on a long stay caseload. So I've already started the interRAI home care assessment because just for sake of time, you don't have time to watch me do that. So the interRAI home care, or the interRAI HC, is a comprehensive clinical assessment that's used across Canada and internationally. It's used to assess persons living in the community or hospital setting to identify their strengths, preferences, and needs, and provides a holistic view of the patient by engaging with the patient and their families in the care planning process. It's used successfully to transition a person home from hospital and also as part of the application for long-term care. So I'm just going to head in here. It's always best practice to conduct the interRAI HC in person. So right now we're at a home visit. So welcome everyone. We're at Athena's house and we are with Athena and her husband, Bruce. So the assessment is set up the same way as we saw yesterday with the interRAI contact assessment, and the patient information and assessment options are shown here on the left-hand side. We saw that yesterday. And the home care assessment is also divided into sections here at the top. You can see that. Now, the interRAI home care does have more sections than the contact assessment, but that makes total sense because this is a comprehensive assessment. And although it can seem like this may take a long time to complete with Athena, please know that this assessment is developed to ensure that only the minimum data required is collected to support patient care planning. So for Athena, this is the first assessment using the interRAI home care. And as the assessor, I will have a great understanding of Athena's needs and be an integral part of Athena's care planning team. When we complete the next interRAI home care, the next time, it won't take as long unless Athena has had a significant change. So you can see up at the top, it's all green, which is green is ready to go. All the mandatory fields have been completed. But I do want to show you a couple cool things here. So I'm going to go into section C, which is cognition. So the interRAI manuals are embedded to support assessment practices for all assessments in the assessment platform. Then this is very helpful for assessors. For example, I'm in Athena's home right now. I need to refresh my memory on what's the intent of this question C1. I can click on the manual. So just by one click, I bring up the manual that's embedded. This is very helpful. I can scroll down and understand the manual. So the intent, the definition, the process, and the coding is just one click away. And that's also for the interRAI CA, which I did not show that yesterday. Also want to show you here at each question item, there is a history. So again, this is Athena's first assessment, so there is no history, but this is very helpful if there had been multiple or previous assessments. I can come in here and see, okay, what was this? How was this question answered previously? And this is going to help me know if there's been improvement or deterioration. Also, there are notes. So each section has a note. So I can put in some more notes in the free text under each section. Some sections do have templated notes as well. All right, so I'm going to head over to, we have one section that's actually in pink, which means we're not quite done. So this is the CAPS section. So CAPS stand for Clinical Assessment Protocol. And because this is a comprehensive assessment, it does provide these CAPS, and they identify patients who would benefit from further care and support in specific problem areas, either because they are at risk for decline or show a potential for improvement, and are used to inform and guide comprehensive care and service planning and support continuity of care. So you can see all of these CAPS. So as part of the care planning process, as I'm in the home visit right now with Athena, I will be engaging Athena and Bruce in the care planning. So I just want to highlight this one that's in red, which is indicating I need to have an action here. So this is the CAP for activities of daily living, and this addresses a person's self-sufficiency in performing the task of daily living, like dressing or personal hygiene, etc. And the goal of this CAP, which I can see here if I want to go look at the CAP manual, it's also embedded. And the goal of this CAP is to preserve current ADL self-sufficiency levels as long as possible. So you can see that it's been triggered here to facilitate improvement. And I know this as the assessor. That makes total sense because Athena does require help in her ADLs, but is not totally dependent. She still has some cognitive assets. She did have a recent fall and a recent hospitalization. So part of my care plan would be to manage any new onset of acute issues like the decline in cognitive performance since coming onto service. So with engaging with Athena and Bruce here at the home visit, we've decided that they would contact the family physician and I would send a physician communication. So I can mark this action as will be addressed in the service plan. This now satisfies all the fields up here, so I can actually come on over here and complete the assessment. Assessment has been completed. And you can see that has now changed to the blue and says completed. So I quickly want to go in here. Yesterday, we did see the trending charts from the CA, but you can see here that we have trending charts for more outcome scales. So it goes down. So that makes sense as it is a comprehensive assessment. And also CAPS are new. You get those. The CAPS are provided with the comprehensive assessments. So I want to also show you the outcomes. So again, just as a reminder, these are numerical scores that are derived from the assessment items that describe a person in certain clinical areas, such as depression, cognitive performance, and activities. And we use these as decision support tools to support key decisions, such as urgency of service or allocation of services and resources. And then again, we can compare over time, but because this is Athena's first assessment, we don't have any previous assessments, but this will make a graph and we'll be able to see if there's been any improvement or deterioration. So I just want to highlight quickly the personal support algorithm. All right, so the personal support algorithm is right here. And it's a decision support tool that can be used to prioritize those needing community services and allocation of services for personal support. And it is derived, so the personal support algorithm that is derived from the interRAI home care is more comprehensive and takes into account more items from the assessment. So you'll remember yesterday I also showed you this. From the interRAI contact assessment. So what's the difference? So the interRAI contact assessment has fewer items used in the calculation because the assessment captures only basic clinical information. So it's important to recognize that while the interRAI CA is a good brief assessment, it is shorter and does not pick up the same amount of outcomes. And so I just wanted to bring that to your attention. And then quickly, I just want to show you the divert scale. And by quickly, I mean briefly, sorry. Just want to show you the divert, and this is alphabetical, and I just have to find my divert. Here we go, right here. So this is the decision support tool that identifies a person's likelihood of future unplanned emergency department visits, and the scale is at a 6, and you can see that Athena is scoring 4 out of 6, which is a high risk. So part of the care plan can be to put in services or send referrals or physician visit when you're creating your care plan that would help to try to not have an unplanned ED visit. So that's there as well. I'm just going to head up to the top here. Sorry for all my scrolling. Yesterday, I showed you the print version, so I won't show you that, but the interRAI home care also has a print version, and then there is a personal health profile. So the personal health profile highlights key clinical and functional areas. Sorry, let me just grab it there. There we go. It shows key clinical and functional areas for the patient and can be shared with others in the circle of care. And as my colleague Kiva mentioned at the meeting on February 9th, we are doing some work to modernize the PHP, that's what we call it, for clinicians, as well as develop a PHP for patients and caregivers. All right, so I'm just gonna head back, sorry. Actually, that brings us to the end of the assessment platform. So I'm gonna actually head right back here to Athena. Okay, so the first thing I can see here is a new button has appeared called Validate. So I just wanna talk about that for a minute. So the outcomes from the interRAI home care are used for the home care categorization tool, or HCCT, which is built into CRIS. This tool provides a recommended long stay population for the client care model. So long stay populations are community independence, chronic, or complex. And if you're not sure what the client care model is, that groups patients into populations and subpopulations according to patient complexity and supports these populations here, support caseload management and care planning. So at this point, as the assessor, I can agree or disagree with the home care categorization tool with the population that it picked. This is built in on purpose so that the assessor's clinical judgment is utilized to, so we're not fully dependent on the support tool. It's the same as the NCCT, which was that new client categorization tool that we saw in the interRAI CA. So I am going to validate this now, and I'm going to accept this change, and I'm going to save. Okay. Oh, no problem at all. There we go. All right, so that validate button is gone now. Now, after coming from the assessment, I do have information to update the client file with. And so yesterday we did do some of the client level tabs. So it is really important to make sure that the information in CRIS is accurate. If I know something new, I need to add it into CRIS. If it's something that is no longer a problem, I can end date something in CRIS. So that is important. So for today, I'm going to go back into the health profile, and I am going to add a risk code. So for the risk code, I'm just going to add an ERL code, an emergency risk level code, and I'm indicating from my assessment that she is a 4, and I'm going to save that. So again, that's now also visible in the header. If there was anything else that I wanted to indicate here, you know, another allergy or another safety issue, I would do that now. So back on the blue overview, I can see that my assessment has populated over. So remember yesterday we saw interRAI contact assessment here. So the newest assessment is now showing here, and it's showing some of the scores right here available to us. So I'm going to go into the client characteristics, and I can see the client and placement attributes. So I'm just going to show the beginning part of this. So this is also drawing from my assessment. This information here at the top, it's also really clearly showing me about my personal support, which I talked about that algorithm. And it's also providing a value in here for these attributes. And I can edit this field and make further comment here. So I have a lot of information at my fingertips right here in CRIS. If I go to the assessment outcomes, I can also see all of the outcomes and the scores for Athena. So again, we've already talked about the divert, which is over here, and we talked about the personal support algorithm, which is here. We also have the caps, so we can see what caps were triggered for Athena and what it was triggered for and what my action was. So I made that action up in the assessment platform because I understand what these caps mean. I know how to action those. And then down here yesterday, we did do an interRAI contact assessment. So if I show that, it's still here. And I can show or hide. Okay, so based on all of that, I am seeing a deterioration in Athena. So we won't be adding more services today in our demonstration just because we showed you some of that functionality yesterday, but we will be ordering medical equipment and supplies. And don't forget, Athena and Bruce will be connecting with their family physician, and I'll be sending a communication. And I'll hand that back over to Mark.
All right, awesome. Thank you very much, Lisa. I always like seeing it in the Acute Net platform how the manual is built into the system. That's so cool. I forgot about that part. Okay, so I'm back on the same patient in the same spot where Lisa left it. I've refreshed the screen, so I do see that emergency risk level code added here. And as she said, when we last left our patient, we were going to order some equipment and supplies. So I'm just going to get right into that functionality. You guys are getting a bit of a sneak peek because there's a new release that recently happened where there's some new efficiencies built into the equipment and supplies ordering process. So that happens to be at the referral level. So I've just scrolled down to the referral level here, home care, and you can navigate to the specific tab where that would be happening on. But as I was alluding to on yesterday, how each level has its own little action drop-down list of common things and activities and tasks you can do at every level. So there's one here for add requisition. So that's the shortcut way of proceeding with putting together a purchase order or a requisition for equipment and supplies. And normally, again, most of you probably would understand that in reality, to be able to be ordering medical equipment and supplies, we probably would have to have some kind of professional service in place. We just have the PSW today, but this is just an example to show you how you would go about doing that. So we're just going to say that it was ordered by myself or by Lisa, whoever's the coordinator ordering this equipment. I'm going to set the delivery date for, let's say, Monday. Delivery priority, you have an option here to say, same day, urgent, weekend delivery. I'm just going to leave it at regular. And then we're going to select the home address. You might have multiple addresses on file. So you're just going to make sure you're selecting the address that these items are going to be going to. And with that, I think all I need to do is click save, and it's going to take me to another screen. Oops. Right, I didn't indicate which Lynn staff. So I'm just going to put my own name here. And it doesn't have to be Lynn, that just happens to be the wording there, but whatever organization is doing the ordering. Okay, so this happens to be on the requisition line item screen. So you can see just a list of fields here. I'm just going to go in sequence. First of all, we're satisfying the type column. We're going to do a rental first of all, P for purchase, R for rental, and F for finance charge. And let's start with the rental of a walker. So I just start typing walker, and you'll get a match of a couple examples of walkers, and you'll just choose. I'm going to choose this one here. I think that's what I want. No, I'm going to choose a different one. Sorry. Here, that's what I wanted last time. Adjustable height walker. Oh, why is this not working? Sorry, I think so. I tested this just before coming here. Perhaps it's one. Okay, there we go. Okay, so it automatically defaults to the geographic area and the vendor who's providing that item. I'm going to save that. That's basically to save that line. And then I can add an additional line. We talked about how I was going to order some medical supplies as well. So I'm going to do that as a purchase. And we're going to order first some dressing supplies. And I'm going to order upsite. There we go. And you can see the geographic area and the vendor providing that as well. I'll click save, and I'll do one more. I will just add another line just to give you an idea how easy it is to do. That's another purchase item, and it'll be some Mepilex I'm going to order. So dressing and Mepilex. Okay, and I can save that. And really, there's other details I can show you in terms of some of the newer functionality, but really just to get through it and with the happy path, I'm going to say finish. It's asking for approval, so I'm just going to put my own name here and save that. And then finally, the screen that it'll closes out on is where you select the items that you ordered, and you're going to say send. There's a button here, and that'll send it to the vendor for them to receive the notification to deliver those items. So that's how you order equipment and supplies. I will just reorient us by going to the client level overview or home base, the blue overview. And just to show you, as we've been doing all along, if I scroll down a little bit, you can see where those items are visible on the overview screen. So there's equipment of the walker and the dressing supplies as well. The vendors here and in this ordered status. So that is equipment and supplies. Now, day 2 is a little bit more ongoing case management type stuff. So day 1 was a lot about setting things up and the integrations. Day 2 today, we're just in ongoing case management. So sometimes that's just dealing with things as they come. So the next thing we want to talk about is just demonstrating uploading a document in the document library. So the scenario I thought about was perhaps we talked yesterday about how the patient got Ontario Drug Benefits, the ODB. So they went to the pharmacy and she got a list of a medication list from the pharmacy and sent it to us, and we're just going to upload that into the patient record now. So this, I've clicked on the Documents tab, and that took me to the document library by default. And this here is basically the document library. You can see there's one document that's been uploaded already. I'm just going to show you how that got there. So let's say I've got an electronic file. It could be a PDF, a Word document, what have you. A lot of different options in terms of format. I'm going to click on Upload Document. It's very much like doing an attachment, basically, for email. And start by choosing the file. And I've got here a medication list from my computer. And then I'm going to choose a document category of medication management and document type, pharmacy medication list. There's just a long list of options to choose in both of those drop downs, but just to keep it simple. And then basically I'm going to upload that document, but this is also a dual demonstration here. I just want to show you at the same time how you go about triggering or creating a manual task. So this is when you want to notify someone. In this case, it's going to be the person who's the case manager or the coordinator who's looking after this caseload. So I'm going to send a manual task from here, and those manual tasks can be set up to be added at different places, different times. Let's say if you're adding a note, uploading a document, different things activities that you do can be associated with the manual task, or you can just do them on your own. So I'll very quickly show you how to do one on your own as well, just to start. But basically, you indicate by selecting a due date. This is like when you want the task to be reviewed by or maybe actioned by. You indicate the priority. Let's say it's just medium. It's just FYI. This task template, I'm just going to choose a follow-up required and review med list with client, for example. There's my as an example. It's just in your own words. You type the message to the person you're communicating to, what you'd like them to do. Sometimes a template as the subject heading is sufficient. And then, as I mentioned, it defaults actually to the coordinator who's looking after this caseload, but you could choose the team or the caseload or the specific person as whatever is necessary. But just to keep it simple, I'm going to cross my fingers that this works. Yeah, so it says here it's been submitted successfully. It's just going to take a minute or so to actually upload in reality. So it's gonna if I was to refresh the screen, it's probably a bit soon. It might take, oh, no, that's good. It came right away. So now we have the medication list here as well. And if you would just click on it, it just downloads a copy of that document. And this is just a sample here. Okay. So I did say I was going to quickly show you how you might do a manual task on its own. I did that in association with uploading a document, but you also can use the action drop down. And in exactly the same way, I'm going to select add manual task. And then I won't go through all the steps again, but it's just the same. You'll just choose a description, due date, priority, and who you're assigning it to. And then you may need to type some additional messages. You might not, depending on the context of the subject. And then you would save that, and it would trigger a task that would be available in the dashboard. So we showed you the dashboard earlier on today, where all those tasks are incoming. So that's uploading a document and adding a manual task. I think we're coming close to the end of the demo, so I think we're going to wrap up, close out today's demo with showing you how to place the patient on a hospital hold. So I think in our scenario, we had the spouse, we got a call from the spouse, and there's been a bit of a decline, as we noticed from the assessment, and perhaps Athena has taken a fall and she's had to be taken to hospital, unfortunately. So let's quickly show you how we can go about doing that, and then how you would identify, looking in different places in CRIS, that this patient is on hospital hold. So from wherever you are, I'm going to select the action drop down that's at the client level, and there's an option to say place on hold right here. So if I select that, this is a good example because it's going to show you a couple different things happening at the same time here. All right, so we've got the on hold screen. The reason could be hospital hold, maybe a vacation hold, for example. I'm just going to select hospital based on our scenario. And then again, I'm looking to satisfy any mandatory fields. That's the asterisk, the little star. So the on-hold location was the Hamilton, Hamilton General Acute Care Hospital, which is where we got the referral from on day 1. The start date and the admission date default to today's date, and then it puts in an estimated end date, and that happens to be 2 weeks. What that's going to do is in 2 weeks, it's going to trigger a task, just like most dates that you set up in Chris will trigger a task that you'll get saying that the 2 weeks are coming up. It's time. Maybe you might want to think about calling the hospital and checking to see if they're still there, if they've been admitted, or if they've coming out, if there's a change in status. So that triggers a task for you to be notified as that estimated end date approaches. So I'm going to click Save and Next. And on this screen, you'll have the option to notify any active service providers who may be involved in the care for this patient. So we had yesterday we had ordered personal support from Bayshore. So we want to let them know. And so you can just check off notify provider, and it'll trigger a message, a notification to them, and they will receive that in a system that's called HPG, Health Partner Gateway, which we'll learn about on Monday. Now, the other thing you're going to notice that's showing up here is another example of some of the smart Chris logic, which is just flagging me to the fact that just today, I ordered some equipment, which is currently just pending. It was just moments ago, so it's not obviously been sent to the patient. So it's just flagging you. It's not an error, but it's just letting you know that there's some equipment that's set to go there, but they're in hospital right now. So you might want to think about putting that delivery on hold and think about when you might want to resend it out another time. So it's just another example of some flagging you, notifying you of something to think about that you might not have remembered on your own. So with that, I'm going to click Save and Send. And you're going to notice 2 things at the very top of the screen. One of which is the status is going to change from active to active on hold. And it tells you what kind of hold. We did a hospital hold. If it was vacation, that's what it would say. And you'll also notice this bright yellow, the triangle here with the H in the middle, just so anyone accessing this patient record, obviously who's in the circle of care, is authorized to do so, would see that flag as well. Also in the patient record, I'll just quickly show you on the service calendar. I'm going to go down to the referral level because I'm just about at time here, and I want to give time for questions. I'm pretty much done. I'm going to go over to this. I'm just navigating to the calendar. As you become more familiar with Chris, you'll know where to go for that. But under the service plan, there's a calendar here, and that just shows you in the calendar format some things that are happening in the patient's list of services. So it happens to show the Bayshore personal support service, but it's not because our contract is not by frequency. We don't see that service listed on this calendar by frequency, but in other cases you might see that. But you do see that hospital hold listed here, and it's over a 2 weeks time span. And you also can spot the fact that we had ordered that equipment. There's a couple purchase orders here on the calendar as well, just flagging that information too. The final place, and this is where we'll end the demo, is just on the client search where we started. We're going to end in the same place. Now we see that, oops, Athena, my thumbs are too big. There we go. Okay, so we saw this morning, or earlier today rather, that one of the patients that we looked for was on hospital hold. We can now see that Athena Demo 2 is on hospital hold as well. So that's another way that you can quickly spot the fact that this patient was on hold. And I think that takes us to the end of our demo. We're going to continue on Monday with a little bit of a continuation of the story, and then some other things that are just general stuff that you'd be interested to know about. So we'll, I think, leave it at that, and we'll open it up to questions if anyone has any. Thanks, everyone.
Thanks, Mark and Lisa. There's a few questions in the chat, which if everyone can see, the answers have been put in the chat. And I don't see any other questions there. I did get one question, Mark and Lisa, via email. For those who are maybe less familiar with the CRIS system, do the SPOs, do the vendors and what they're documenting about the care they're providing, where does that go? Does that go into Chris, or like how are the notes exchanged? I guess people are wondering, between the notes the care coordinator's making in the Chris system and the notes the clinicians working for like Bayshore are making about the care they're providing.
Yeah, I can start that off. I'm actually going to demonstrate that for real on Monday, but I'll
Okay,
talk
that's
a little
fine
bit
then.
about that now. They have provider reports. As an example, there's provider reports that they send, and it kind of could go in the document library, or there's a section called provider notifications where you receive that, and we will get flagged of those updates of whatever kind that they send in the dashboard. There's Yeah, I'll leave it at that in terms of how that could work. They can upload documents as well to the document library, I think I mentioned. So yeah, but we'll do it a live demo and show you exactly how that works on both sides. There's also the coordinated care plan. I'm not sure who's familiar with that, but we'll show you what that looks like and how that's a bi-directional tool as well for those who are the folks who are in the circle of care, where we can update it on this side and we see it in HPG by the providers, or the provider can update it and we can see updates that they've made. What was changed, who made it, and from where they work. Yeah.
Okay.
It's pretty nice.
Thank you.
Mm-hmm.
Any other questions? If anyone on the line wants to unmute and ask their question. I'm counting to 30. Yeah. Is there still a plan to discuss transitioning between tenancies? So will we see a demonstration of how you would switch from one Chris tenant to another, is the question.
We can show on Monday, just for my part. I'm not sure if anyone else wants to speak to this, but I'll be able to show if you're in one tenant, how you can see some content from another tenant, like a summary, like provincial client view is called, like a read-only view of. Anyway, you'll see what we can see there, but you can see things like the referral and the service types, either in a detailed view or a summary view, and a lot of the demographics and some of the stuff that we see. A lot of the stuff that we see on the overview page panel. If I can just do a very, very quick preview now. It really, this provincial view comprises a lot of what you'll see here. This is the main overview here, and so a lot of this stuff.
I'm not seeing your screen yet.
Oh yeah, I'm sorry. Thank you.
If you want to share.
Here we go. Yeah, sorry about that. Yeah, so in the patient record on the overview tab, you'll see a lot of demographic details and some of the stuff that's being pulled from this whole overview summary page. Slightly different format, but generally this kind of stuff. But we'll demonstrate that on Monday for sure. That's a big piece of what we're doing Monday. Good question.
Great. Any other questions? I don't see any hands. Going once. Going twice. Okay, I think everybody's eager to start their weekends. Thank you so much, everybody, for joining us today. If you do have, think of questions or feedback, and again, either for this or something that you want to make sure we're going to cover in the workflow sessions, please just email me. I'll pass them along to the team. I can kind of be the go-between person for the comms. That would be great. And we'll see you all on Monday then.
Thank you.
Thanks, everybody.
Get home safe in the snow for those of you who are not home already.
Yes, safe driving.
All right, take care, guys. Thanks.
Take care.
Thanks.